I'm going to call this meeting of the Health Committee to order. I'd like to have Councilor Soap give the invocation, please.
Please stand.
Dear Heavenly Father, Lord, creator of all things, we come to you this morning. We just thank you for your many blessings you've given us, Lord, as people and as tribal citizens, Lord. We just thank you for the direction you've given us each and every day. Thank you for the wisdom that you give us. Thank you for the love in our hearts, Lord. Just pray that you be with our people, be with those that are in need, and help and guide them, Lord, to find the health and to help them find the presence of mind that they need today, Lord, in order to live a happy, healthy life. Just thank you for all these things. Be with our soldiers and be with our tribal leaders. In Jesus' name, amen.
Next, we have roll call.
Bradley Cobb, Janelle Fulbright, Gil Anglin,
Here.
Gil John Baker,
Here.
Jack Baker,
Here.
Harley Buzzard, Julia Coates, here. Joe Crittenden,
Here.
Jody Fishenhoff, Meredith Fraley, Don Garvin, Hannah Glory Jordan,
Present.
Curtis Snell,
Here.
Chris Stubb,
Here.
David Thornton,
Present.
Kara Cowan Watts.
Honey.
We do have a quorum.
Next, we have approval of the August 17th, 2010 regular session minutes. I would entertain a motion for approval.
So moved.
Second. We have a first and a second. All those in favor of approving the minutes say aye.
Aye.
Any opposed? Motion carries. And next for two reports. From the Claremore Service Unit, George Valeri, Councilor Garvin.
Before it starts, I want to report, I talked to Janelle Fulbright, and her brother had a serious operation yesterday. She said he's doing better this morning, and that's where she is in Oklahoma City. She's on her way back, so everything's looking better.
I appreciate that. I hope he does well. I know that's been a long, drawn-out deal. George Valeri, Claremore Service Unit, you are the next contestant.
Good morning.
Good morning.
One announcement before as I get started. Our medical director, Paul Mobley, is retiring as of this Friday. Will be his last day there at the facility after 25 some odd years. He's retiring, and I'm trying to get an announcement out, get it expedited so we can get that position filled. My report should be, you guys should have copies of that. We're on pace to increase our collections by the 1% that area asks us to increase it by. Our new era roof should be done by mid-October. We're not going to have a flu shot clinic, a drive-through flu shot clinic this year. With the state of Oklahoma charging for their shots, historically they have always given us a lot of flu vaccine, and therefore we had flu vaccine for non-beneficiaries that came through. They're not giving us any this year, so instead of throwing the nurses out there to argue with people about who can get the shot and who can't, we're just going to have walk-through clinics inside the hospital. So there's no drive-through flu shot clinic this year. We just had a kickoff meeting yesterday. We're doing $1 million upgrade to our IT infrastructure. We're putting in new servers, new phone system, and for the first time, Claremore Hospital will have a wireless network, which should help greatly with the electronic health record throughout the whole hospital. As you may recall, we've had trouble getting recruiting OB doctors. We have one accepted. He is actually going through orientation as we speak. We're supposed to be making a second offer. Actually, we've made a second offer, and he is debating the third, and we're getting ready to make a third offer to a third physician, so we may be fully staffed. Hopefully by next month I'll have some good news. We may actually be fully staffed and can cancel all the contract positions for OB and women's health. Like I said, revenues are up, visits are up. Any questions?
Do we have any questions regarding Claremore Service Unit? Councilor Cowan Watts.
I just want to thank you again. I know that I thank you when we're at the board meetings in front of all of our council people. I don't know if you guys realize what he's been able to do just in a year, but there's already drastic improvement at Claremore Indian Hospital, and thank you. Because I know you take a lot of time away from your family.
You're welcome.
Councilor Buzzard.
George, the third-party collection, do you have private insurance? Does that include center care? Is that reported within private collection?
No.
Or do you do center care?
No, it's reported under Medicaid.
Oh, okay.
Any more questions? I did want to point out that's a pretty big positive, your private insurance number above and beyond Medicare and Medicaid that's a positive trend there, so. Any more questions? Thank you.
Thank you.
Next, from Cherokee Nation Health Services, Melissa Gower.
Good morning.
Good morning.
You have my report. If you have some questions, I'll try to answer those.
Do we have any questions from Melissa Gower of Cherokee Nation Health Services? Councilor Buzzard.
Melissa seemed like I voiced that question, but
That's okay.
and I
Any
want to
questions?
the patients and the people there at the J Clinic appreciate the podiatrists we got up there. They're really, I've had some good comments about it. But I want to check, and I've talked to you about a podiatrist, a foot doctor. But I'd like to see some numbers, because I just think we have a lot of patients that are diabetic around the J, Kenwood, Oaks, called for it. And I know I've asked to see if we can get a podiatrist in there to help with some of our patients like that. And I know you told me that you're going to actively recruit one. But have we looked at the numbers and see how we compare with other health facilities as far as diabetes people go? Do you know that?
Our scorecard has all kinds of health outcomes on that we review on a monthly basis. And there's several of those outcomes on there that relate to diabetes. If you're interested in those scorecards, I'd be glad to share the third quarter report for you.
Yes,
and you can see what the outcomes are that we measure, and we measure it by facility.
Okay.
And you can see what the outcomes
Yeah,
are. So I'd be glad to send.
Sure. And the other thing that you told me that I didn't know, and maybe some of the other people don't know either, but as far as dialysis treatment centers, I didn't know that we paid for that, or didn't pay for that, which is good because it all comes from Medicaid and Medicare.
Right,
so I understand what our reasoning is now
Yeah.
for trying to get those out. So
Yeah.
that's good information that you educated
Thank you.
me. But thank
I'll
you.
send you a copy of the third quarter report.
Sure. Thank you.
Any more questions? Councilor Jordan.
Melissa, will we have the flu shot drive-through this year, or are we going to do that a little bit?
Well, we haven't decided exactly what we're going to do. We're going to do something, but I think George referred to this a little bit. The big hiccup this year is that the county health department, state health department as a whole, has decided that they're going to charge $25 for every flu shot they give. I personally think that is horrible, to say the least, since it's a public health issue, and I think there's going to be a lot of people that won't get a flu shot this year. So we're pretty disappointed in that decision by the state health department. And previously, with the same as George talked about, we would do our drive-through, and the county health department nurses would come down and they would bring their vaccine for the non-bins, and we would set up together and do it so everybody could come through. Since that's not going to happen this year, we won't have enough vaccines for the whole community. So we're still, Gloria is still deciding what our best thing is to do. We'll do something, just don't exactly know what that is as of today.
Okay. Thank you.
And that's because of that new information.
I could see how that could be a real...
And that's why they're not doing theirs this year, because they're charging for flu shot.
What does that vaccine cost per unit? Do you have any idea?
I don't know. I can find out for you if you want.
Maybe if you could give us a report next
Sure.
time.
Or I can just
email it if you don't care. I appreciate it.
Okay.
But if only the Cherokees get the flu shot and the non-Indians don't, I mean, I don't see how that's really gonna help our communities that much. All the little non-Indians will have the flu and give it to all of our folks
I
somehow.
think we should all
some
call
way.
the health commissioner.
What was their reasoning? What was their reasoning behind it?
I don't know that.
You can actually go to Reesers and get it, I think, for $15. So if the health department's charging $25,
It
I guess
just,
they put themselves out of business on.
It seems a real
shots.
fundamental problem for me because I think that's what the state health department is a public health agency. I don't know. Anyway, I won't say anymore.
I appreciate that. I appreciate what you're doing as far as trying to. That's very popular, that drive-through, but I can see how you really can't do it if you've got.
I mean, they
folks that
would
don't.
always bring, about 4,000 doses, and so I don't know.
Councilor Sutton.
Yeah, listen to Councilor Fishing Hawk brought this up during our budget hearings, and when it was a little bit about recruiting
Yes.
in the healthcare arena. And I'm just curious as to what the Cherokee Nation is doing as we look for opportunities for improvement in that arena. Can you just talk a little bit about some of the things that you guys have identified, or if you have a plan in place for focusing on these efforts and what you guys are doing?
Sure.
At some point in time, we can always blame the government because, they have such low pay grades and all this other stuff. But as we become more and more responsible for our own decisions, what are we doing
Sure.
as a tribe to look for those opportunities for improvement?
Okay. Well, I'm going to make some general statements and then I'll go to some specific stuff.
Okay.
But, overall, and I think the perspective for me is, first let me just say up front that we can always do better. And I've already met with my finance director, and we're going to really work on position control this year. So just want you all to know that I'm taking that extra step, and we're going to make that a focus and work on it. So I did hear that, and we're going to try to do better. Secondly is, we have 1,800 positions in health. Our turnover rate is 7%. National average is 12 to 15%. So just kind of give some big numbers, but we have about 240 something providers in our system. I have 5 physician vacancies in the whole system right now. And I have, I don't know the exact number, but it's 4 to 6 dental vacancies, and part of that's because of the new services we're bringing on at Salina and Addition in Muskogee. So we really don't have a real difficult time in hiring providers, and we have some of the best providers in the country. I mean, our credentialing process is very restrictive. We have board certified or board eligible providers, who all do a wonderful job. We do, where we really have problems, is, and I'm going to say this the blanket, and then I'm going to talk a little more, but is in nursing. And we can hire new grads all day long. But the problem is when you get in a hospital and you need nursing staff that are specialized and have experience in OB or in pediatrics or in med surg or in orthopedics, or you start looking at the various units where they work, where we really struggle is being able to get experienced people that has that experience when they come in. Because a new grad, and I'm serving on a workforce work group for northeastern Oklahoma, a new grad, an average training period is anywhere from 2 to 3 years. And so I think we probably have 15 or maybe even a little more than that RN vacancies in our system now, noting that we have 300 or 400 RNs. But one of the reasons for that is because we've hired almost all the new grads we can hire. You know, you just can't saturate your whole system with new grads because you have to have some people that are available to mentor them and, you know, assist in training them in the specialty areas. So I've talked to Hastings about that, and so me and Dr. Chuck Grimm and Dr. Doug Nolan there and Jonathan Merrill, the acting nurse executive, and Mitch Thornberry, we're going to sit down within the next 30 days or so, and we're going to talk about that. Because that is probably the highest issue I have right now in recruitment. And so we're going to talk about, you know, what do we need to do to try to fix that problem. And I don't know what the answer is to that. I'm sure that they're going to have some great ideas, and we'll come up with some kind of solution and plan to do that. So I just say that, I guess, to let you know that, you know, we have identified that as an issue for that reason. And when I brought it up at the workforce meeting in Muskogee last week, same thing from all the other healthcare providers there. It was the experience piece that is really hurting. And part of that, you know, I think David Thornton brought it up last week, but, you know, when you get 15, 20 years experience, you can pretty much do and go wherever you want to do and go, and a lot of them do go to work for staffing companies. But, you know, what we have to do is, and I think I said this, but when we have those vacancies, you know, we have a staffing company that we contract with, and we pay those dollars to the staffing company to provide those temporary fixes until we can get some staff in. But that's kind of one of our front burner issues right now for nursing, and we're going to try to come up with a plan for that.
Thank you. Councilor Jordan.
In kind of keeping with that, will you continue to explore that directed studies issue?
Yeah, I mean, we'll talk about it, you know, again, and kind of going along with what I was just saying is, you know, the problem right now is not hiring new grads. The problem is hiring people that have experience. And I understand, I started out, and I know you got to get experience somewhere, and we're doing that. I mean, we've hired a lot of new grads, and we hire a lot. But our problem right now is trying to fix the problem of being able to recruit enough people with experience so we can hire more of those new grads.
Is it the money, Melissa?
No, I don't. I mean, part of it may be for experience, and that's one thing we'll look at. I mean, we're very competitive with base pay. You know, we don't have problems hiring RNs. The problem is when you, I think, well, one of the things that, not me, but one of the things they talked about last week in the workforce group I was in was that, you know, there was such a shortage of RNs for a long period of time. Now, that same group are the group that is, you know, got 10, 15, 20 years experience. Well, now they've run those pipelines so much trying to fix the shortage that we have lots of RNs now, but they're all in this no experience category. In the category with experience, you still have a shortage, because that's the group that was the shortage of RNs when they started working on the issues. That makes sense? You know, those people have gone through the system, and now that group is the group that there's a shortage in ones with experience. So somehow we've got to figure out, you know, how to fix that pipeline.
Are we voting to sign on?
We are not. But, you know, we're going to look at all of that. That's some of the stuff we're going to look at in the next 30 days.
Councilor Baker.
Yeah, and Melissa, this a little different. And we talked about it over the years about caps and bridges, and we're not going to do it, and we can't do it. But have you ever considered? I mean, we've got dentists that know how to put caps on. We've got dentists that know how to make them. We've got dentists, but we don't do it. If you go to a dentist and you don't have insurance, we don't do it, so you go to a dentist and he wants to charge you $1,200 for a cap. But we could buy a cap wholesale for like $200. And we got dentists that know how to do it. What if we had a fee system where we don't do caps, but if you'll buy the cap, we'll put it on for you?
Okay. So we, and I've been talking about this for a year or longer now probably, but, and I know that I've reported here that we did buy 2 crown machines.
Okay?
Bought those in our equipment monies for last year. There's a training process on those particular machines. So we have probably half of our dentists have gone through that now. And we have draft policies for all of that.
Praise the Lord.
And so that's going through our policy approval process. So I can tell you that we're getting really close.
Okay. Good.
Just need a little more time to make sure because it's gonna create a new demand. So we got to make sure that, you know, we're doing it fair and equitable across the system.
Councilor Callan Watson.
Thank you, Mr. Chair. And I just wanted to clarify for the record, because there was a statement at some point about University of Kansas Medical Center deal. So that was back in July, and I assume we're partnering with groups like that, because I think I may have sent it to you guys, Kathy and stuff, because in July, National Institute of Health, I don't think the Cherokee Nation or any of us had anything to do with it, had funded that for $7.5 million, which part of it was the pipeline program and stuff. And I don't know if those federal dollars allow for coming into the Cherokee Nation and thus Oklahoma.
Sure.
But if there's a way to get some of that pipeline money, maybe to fund some of our science, technology, engineering, mathematics programs, which create pipelines for those healthcare, but we've cut back. You know, maybe if we could contact them and help target the population, because their Indian population in Kansas is pretty small compared to ours. So maybe that's an opportunity. But I wanted to clarify for the record that that was HHS, federal dollars to the National Institute of Health. Nobody on this council or anybody had anything to do with it. That was something that was announced through University of Kansas back in July.
So we're doing a couple of things currently. One is that we've been working with Diane Kelly's group, and I think their resolution came through the council last night. I can't remember if it's on there or not, but I think it was, that they're applying for a grant, and we've provided all the information and helped them write that grant. That would do some pipeline for health professions and careers. So if you get a chance, you know, say a few words for us that we'll get that grant, because that'll be helpful. And then the second thing is I've been working with Dr. Veneman at NSU, and we have put in several appropriation requests through Congress to do some pipeline funding for some health professional careers at NSU. And we did it last year. It wasn't approved in the appropriations. We've done it this year, and Dr. Veneman has reported to me, and we've helped them lobby for that, it looks like they're probably going to get some of it this year. So we are trying to identify some federal sources for workforce with NSU and through other avenues to try to help with some of that.
Thank you. Thank you, Mr. Chair.
Any more questions? Thank you. Next, we're to old business. There appears to be none. New business, there appears to be none. Are there any announcements? Councilor Snell, I know you handed something out. Do you have an announcement on that? Even though it's not health, I know it's something.
I got this, little deal, England and Cowboys gospel singing. They've had it for several years. It's a pretty big deal, and they want everybody to know about it, so I got this little handout.
Any more announcements? I will entertain a motion for adjournment.
So moved. Second.
First and second, all those in favor say aye. Aye. Any opposed? We are adjourned.